everyone. This will be a short venipuncture guide, how to draw blood. As you can see, first slide shows necessary equipment. Starting from the left-hand side, you can see non-sterile gloves. Then there is green tourniquet, some gauze, alcohol swabs. Here I'm using 2% chlorhexidine. Then you have sterile plaster, butterfly needle, and blood specimen samples. Turning into blood specimen samples, as you can see, all of them have a different color tops, which is important because it means that you will have to choose the right one, depends on the blood request. Whenever you will have to check patient coagulation or clotting system, you will choose the blue one. So, for example, prothrombin time, activated partial thromboplastin time, fibrinogen, D-dimers, INR, all of those tests, when requested, and you have to draw a blood, take blue one. The purple one is usually used to check full blood count. And sometimes also when we suspect diabetes and we need to check the specific marker for diabetes, which is HbA1c, we will take also a purple one. Yellow one is used for biochemistry purposes. Tests such as UNE, LFTs, CRP, bone profile, magnesium, lipids, thyroid function tests, cardiac enzymes, various endocrinology, oncology, toxicology, viral and immunology tests, all of those will require yellow top blood specimen bottle. Green one is also used for the hematology purposes. Then we have gray one, which mostly is used only for 2 tests: glucose, random or fasting, and lactate. The pink one is a very specific one. You will usually be asked to collect the pink one whenever the patient will need transfusion, blood transfusion. So you will send 2 of those to check his blood group and make sure that the patient will receive the correct blood type, and there will be no side effects from the transfusion. In this slide, those blood specimen bottles are placed in the correct order. So if you will need to take all of them for a patient, the order will be that the blue one will be the first one, purple will be the second one, yellow will be third, green fourth, fifth gray, and lastly pink one. The order of the collection is important because, as you can see, some of those bottles have substances, gels inside. So if you will collect blood not in the proper order, then the results may be in some way falsely interpreted. Right now we should focus on arm inspection. If you have everything in place, you have a patient, and you need to choose which arm. Remember that you should always choose the arm which doesn't show any signs such as edema. For example, in this picture, you can see there is very extensive edema of the left arm. Then avoid always an arm when there is any hematoma. Those 2, if you will try to collect blood from arm with edema or hematoma, you can expect that the blood results will come back deranged, will be falsely raised or decreased. Then another one is extensive scars and fistulas and grafts. In this picture, you can see there is fistula. So you should never take blood from the arm where is fistula or the scars. It will be not only very difficult to collect because there is a lot of fibrous tissue, but accidentally you can puncture artery because it will be very difficult for you to palpate a vein. On this slide you can see scars. So whenever the scar is, you won't feel anything because it will be fibrous tissue underneath and it will be very, very difficult for you. Whenever you have a patient who has already IV cannula in place, try to use the opposite arm. Avoid taking the blood from the IV cannula side. If the drawing blood from an opposite arm is not available, to obtain satisfactory sample from the arm with IV cannula will require from you 4 steps. First of all, you will need to turn off the IV infusion for at least 2 minutes before venipuncture. When you apply the tourniquet, always apply below the IV cannula. And when you select the vein, always try to select other than the one with the IV cannula. And once you've got blood flashback, discard first 5 ml of blood before drawing blood in the specimen tubes for testing. All of those steps are crucial because otherwise, if you will, let's say, take vein, the same vein where the IV cannula is placed in, and there is still running IV infusion, blood results will be completely deranged, falsely showing that patient can have hyper or hyponatremia, hypoalkalemia. And of course, whenever you request blood tests, you request them for the reason. So if you got deranged blood tests, you need to act on them. So try to be careful and always make sure that the arm which you choose is nice, without scars, without edema, without hematoma, without any infection, like in this picture. Avoid infection site because you can introduce bacteria into vein and it can lead to sepsis. Okay, and on this slide I also had a PICC line. So IV cannula PICC line, try to take the blood from the opposite arm. Now you need to know anatomy, how the blood veins goes. In this slide we put the location of veins and arteries in our arms. As you can see, this one here is a cephalic vein. The opposite one is basilic vein. This one in the middle is medial cubital vein. Okay, the most common chosen venipuncture size is, first of all, medial cubital vein and cephalic vein. So those two are the most commonly chosen sites. Then basilic vein, here is the third one. Okay, so now let's have a look how the blood should be taken. Always remember, when you are going to a patient to take a blood, first of all, introduce yourself, check patient details that you have the correct patient. Once this is confirmed, you should explain what you are going to do, explain the procedure and indication. When you see that patient understands what you are going to do, ask them if they are okay with you to take some blood from them. Once you've got consent, wash your hands, put some apron, apply tourniquet about 4 to 5 fingers width above the planned venipuncture site. Now palpate a vein. Once you've identified vein, put on gloves and clean an area in circular motion for 30 seconds. Then you take a needle. Always remember that the bubble should be upside. It will be easier for you to take the blood. Then you need to stabilize an arm and check if patient is still okay to go ahead with the procedure. When you are ready and patient is ready, warn the patient about a sharp scratch, and then again make sure that the vein is secure and insert a needle at 20 to 40 degrees in the direction of vein. You should see now blood flashback. It means that you are in vein, and what you need to do is attach a vacuum container tube to collect blood. Fill as many bottles as required. Once you've got it, remove blood specimen bottle, put it on the side, then remove tourniquet before taking a needle out. Once the tourniquet is removed, you're taking very carefully needle out and place cotton or gauze to cover the side of the needle injection. Discard needle in sharp bins to avoid any needle puncture. Ask a patient, or you can apply a pressure over the site, puncture site, for about 1 minute. Then you can fix the dressing yourself with some cotton and tape, or you can apply sterile plaster. Then the only thing which is left is just to thank the patient. And now you take all the blood specimen bottles with you. You correctly put patient details on them, fill the form, and send those bloods for tests to a laboratory. For now, I'm saying goodbye and bye-bye.